Today, I want to just start with a question. And how many of you have had a situation where you've maybe seen traditional medical provider and you've had endless medications, endless doctor visits, and in the end, you just are kind of left with vague answers and really no solutions to your problem, right? And so what I'm here to tell you today is there might actually be a better way, and that's to treat the cause and not the symptom. So if you look at any kind of health data or anything like that, the Centers for Disease Control says that 60% of us suffer from a chronic disease in the United States. 40% of us suffer from 2 chronic diseases. Now, a chronic disease is going to be something like cancer, heart disease, something very serious like that. And from 1990 to 2020, there's been a 30% increase in the incidence of diabetes in the United States. 42% of us are overweight, and 1 in 4 people in the United States die annually from a cardiovascular event. So that, to me, is fairly alarming. But what we really want to consider is, like, why do we have these chronic diseases? Because if you think about all of the technology we have, all of the research that's been done, all of the things that we have with prescription drugs, and 66% of our commercials on TV are drugs. Thing you want to ask yourself is our health really getting better because of traditional medicine, or is it not? And I'm not here to bash traditional medicine. There's always going to be a time and place for that. But what we want to think about is, why would we put it this way? So if you have, let's think of symptoms, for instance. A symptom is the result, and this is how I want you to think about it. A symptom is a result of something else going on in the body. So for instance, let's take high blood pressure. The most common thing you get, blood pressure medication, right? But if you think about what the symptom is causing, that's very rarely ever asked by a traditional health practitioner. And so in a traditional approach, what we want to ask is why. And so that's what you really want to ask yourself, and that's part of my message today. Is anytime you have some sort of a health crisis and you're being offered a prescription drug, and maybe it's sometimes it's essential, sometimes it's not, but what you really want to do is you want to dig a little bit deeper and ask yourself why. So for blood pressure, for instance, are you drinking too much alcohol? Are you stressed out? Is it that you're not exercising enough? There's all kinds of other root causes. And that's what I mean by treat the cause and not just the symptom. And this is perhaps where traditional medicine maybe falls a little bit short, because whenever you have a symptom, you present yourself to the doctor, and the doctor says, well, here's this drug, or here's that drug, or, that's kind of basically where it ends. And if you stop that treatment, what happens? The problem comes back, right? And so that's why when you see a practitioner that practices functional medicine, functional nutrition, or you see a naturopath or somebody who looks at health from a natural perspective, they're always going to be asking you why. Why do you have that particular concern? And so maybe you show up to our office with a symptom, but that symptom is going to be looked at at a deeper level. And so take, for instance, depression, like we just talked about. And to a functional practitioner, that's going to be the gut, for instance, right? We're going to look at the gut, and we're going to think, like, so why do we have depression, right? And a lot of times, like I said, that can be the gut. So also with functional medicine, we have laboratory testing. And so there's traditional labs where you just, I'm sure you've all, or some of you have had labs run, right? And you get this piece of paper and it's a bunch of numbers and it's all in the green. But then what I hear a lot is, well, my doctor said there's nothing wrong with me. But of course there's somebody sitting in front of me and they're like, but I feel like something's wrong with me, right? I know there's something wrong. And that's where the difference with functional medicine, let's call it that, is where we'll look at those lab tests and we'll say, well, what would be the optimal for this patient? And that's where we can find a lot of issues that are what's called subclinical. And maybe it's not going to show up as, oh, there's a problem that is high or low, because you've probably all seen those lab tests, right, where it just is high or low. But there's a deeper understanding of blood chemistry. And for, thousands of years, at least for the last 150 years, there's been, natural medicine has always been there. But since about the 1940s, that's where we've seen the rise in synthetic drugs and lab-derived drugs, or what's called big pharma, I guess you could call it that. And again, not a political comment, but just that's been the focus of our traditional healthcare system for probably the last, let's say, 40 or 50 years. But natural medicine never went away. I mean, naturopaths have been treating patients this way for over 150 years. The term alternative medicine came about in the 1950s because guess what? Patients eventually, after about 20 years, started to get sick and tired of being sick and tired, right? And how many people feel that way? I mean, it's just where are we going to start making that decision that, guess what? I don't need to wait until there's a healthcare crisis that's going to show up in my life, because that's when you get symptoms. Part of my message today is to be proactive and not reactionary to your health, because guess what? By the time you have a symptom, it's already too late. And just a quick story. So we had a patient show up, and I'd met her at I think it was a chamber event like 3 years ago, and she'd heard me talk about taking a functional approach to your health. And she came into the office and she says, I can't sleep. I've lost a bunch of weight. I don't feel really well. My doctor says my lab tests are normal. And I don't really know what's wrong with me. I feel like something's wrong, but all my doctor wants to do is put me on like antidepressants. And so I said, okay, let's run some labs. Talked to her a little bit, and she mentioned something about fasting, and like she'd been intermittent fasting for like 3 years. And so she's essentially kind of starving herself when she shouldn't have been. And so I said, just try this. And then let me know how this goes in two weeks when we meet up. And I had her just eat a cup of rice at night. Or I said, eat a cup of rice or I don't know, eat a cup of berries or something like that. She was deathly afraid of carbohydrates. And she calls 4 days later, wants to talk to me. I'm like, oh, geez, what's going on? What did I do? And she was crying on the phone, right? And the reason she was crying was because she'd slept for the first time in 3 years. And all I had done is listen to her and pick out some things that just uncover a few layers of her life. It wasn't that I was so great. It was just like what I heard from her is she was missing a key component. That was she needed to eat carbohydrates. All I had to do was take it before bed, and she started to sleep, right? And so because of her lifestyle, though, we ran some labs, and we found that she had hypoglycemia. She was anemic, and I think maybe she might have had actually had a thyroid issue. So it took about 18 months to get this under control for her with nutrition, diet, hormone balancing, and things that natural practitioners do when we see patients. So she's been a patient for like 3 years now. But the reason I tell that story is because her friend came with her, and her friend I didn't know this lady. She just kind of came in and sat down in the room. And by the time the consultation was over, this lady stood up when I was like, kind of shaking hands with the patient. And she grabbed my hand, and I was kind of taken by surprise by this. And I was like, well, she's looking me in the eye, and she goes, I just want to thank you because you saved my friend's life. And I was like, wow, okay, cool. That's so awesome. She's like, literally, I don't know what she would have done without you. Not saying that from the standpoint that I'm so great, but this lady's life was changed because I took the time to listen, and we got her the right care that she needed. And she got her life back, but her friends also felt like they were going to lose her friend. And she literally said, we thought this lady was going to die, right? And so that's why I'm so passionate about functional medicine. That's why I talk about this all the time. And, this is what I do. I think I was getting mic'd up. You said I was a chiropractor, right? So I started as a chiropractor, but this, becoming board certified in functional medicine was born out of the fact that there was so many questions with patients who had back pain and arthritis and all these different issues. I just had to start learning this stuff because patients were wanting to know these things. And I think that's really what the public is looking for now, in my opinion, is natural approaches. They don't want cover-ups. They don't want quick fixes. They want long-term solutions. And that's also my message today, is that, the power that made the body heals the body. And I always want you to remember that. And healing in the 21st century is really going to be where patients take a functional approach to their health, where they take a proactive approach. You want to be proactive and not reactive. And on a bigger scale, the vision is that not only would society be healthier, but think about the burden of healthcare costs in the United States. How much do we spend on healthcare? How much of it is really actually effective? But if we could actually get the chronic disease to go down, to get the incidence of chronic disease to go away, then the economic and the societal burdens would drastically be reduced for all of us. Now, there's always going to be a time and a place for traditional medicine. Traditional medicine is not going to go away. But when you do have those issues, I want you to also think of when can I take a functional approach? When would this be a good idea for me? And if we blend those two together, we actually can see our health improve drastically. So thank you very much.